Okay, so when we're talking about heart rate and rhythm, we want to think about a heartbeat kind of like a family. Okay, so if my P wave is my wife, my QRS complex is my husband, and my T wave is my child, that tells me everybody's an individual, right? My wife should have a nice close relationship to her husband, the QRS complex, and the kids should follow right behind afterward. But we're all individuals and we all do our own thing. So we all are individual people. So a heartbeat is actually like a family. Okay, everybody should return to baseline. Everybody should be there. So if I'm looking at my heartbeat, my P wave, which would be this little guy, that would be my wife. Okay, I return to baseline. I've got a little segment between me and husband. Husband is QRS, right? I return to baseline. I've got another little segment here, and then there's my kid, the T wave. If I have a happy family, my P to R interval will be tight and close. We get along well. T wave will follow shortly behind afterwards, and everybody will be exactly the same distance apart. Okay, that's normal sinus rhythm or the happy family. Okay, with the happy family, which is what this is, I should be at about 60 to 100. Okay, so I should be about 60 to 100. So if I'm at 60 to 100, that's normal sinus rhythm. So looking at this, I'm running at 60 to 100. My P wave is close to her husband. QRS complex follows behind it. T wave follows behind it. Everybody's identical. Everybody follows the same rate. Nothing changes. Okay. This rhythm with no pulse is considered pulseless electrical activity, right? Pulseless electrical activity is any organized rhythm without a pulse. So with that being said, what do I do for PEA? Epi, compressions, and pray to Jesus I can get them back. It's epi, press, and pray for asystole and PEA. So if this has no pulse, this would be pulseless electrical activity, which means epi, compressions, and hope to Jesus I can get my patient back. Okay. The other rhythm like that is asystole. That is my other epi, press, and pray. Okay, that is asystole. A flat line, there's nothing I do for that. I have no electricity going down. All I need is to get that heart muscle pumping. That's what I want. Okay. So let's go back to my normal sinus rhythm or my happy family. So normal sinus is 60 to 100. Now we also have that family that's a little bit lazy. They don't ever come out on the weekends. They play video games at home all day. We don't ever really see them, but they do come out on occasion and mow the grass every 2 weeks. That would be sinus Brady. Now, that family's still happy. They just kind of mind their own business, do their own thing. That's just slow. Sinus Brady is just slow. That's the lazy family that's just kind of hanging out. But my P wave is close to her husband QRS complex. T wave follows shortly behind afterwards. I'm just at a rate of less than 50. Okay. If I'm symptomatic, altered mental status, I'm diaphoretic, I'm having chest pain, I want to get a 12 lead. I want to hook them up to the monitor. I want to consider giving my medication, giving some atropine, possibly a milligram, and figure out what my underlying causes of the bradycardias are, right? Cool. Now, my triple ball family that ain't ever home, that's these guys. So that's going to be still a happy family, but they are always on the go. That's sinus tach. Okay? Sinus tach 101 to 150 for our adult victims. Okay? Same thing. I may give a little fluids for this depending on what's going on. I need to find out what's causing this little bit of tachycardia. It could be that they just had a Red Bull or they've been running or something like that. But sinus tachycardia that's not symptomatic, we're going to leave that alone. If it's symptomatic, we need to find out whatever the underlying cause is and possibly deal with that accordingly. Okay. But all of those rhythms with no pulse are considered pulseless electrical activity, which means epipressive rate. Okay. And monitor if necessary. Now, let's go back to my happy family. Now, what happens if that child got in trouble at school? Okay. He's going to get in trouble, right? I know what happened to me. Living in South Louisiana, my butt got whipped. Okay. It's not comfortable. It hurts. So if my butt got whipped and I'm the T wave, Dad spanked my butt, that's going to be called a STEMI. Okay. Cause pain. So I'm leaving a beat up here. You can see it. This first two little beats are normal sinus rhythm here and here. Okay. STEMI stands for ST segment elevation myocardial infarction. All that means is the segment between dad and kid is raised off of the baseline. Okay. So where it should be touching baseline, dad should be down here. It automatically jumped into my T wave. So a STEMI stands for ST segment elevation myocardial infarction. This is my heart attack. This is my ACS. Okay. With ACS, remember, you want to get a 12 lead EKG done. We want to get aspirin 162 to 325 on board as soon as possible, chewed up. Give nitro if necessary. And remember, we can give nitro every 5 minutes times 3. and they need to get to a cath lab. We need to get them to cath lab within 90 minutes of first medical contact. Okay, get them to PCI within 90 minutes or 30 minutes of fibrinolytic therapy, but 90 minutes is your magic number. Their O2 sat's less than 90, we're going to apply oxygen. Remember with your ACS, our contraindications to nitro are bradycardias, tachycardias, any current use of phosphodiesterase inhibitors like your Viagra, Cialis. And remember that drug was originally pulmonary hypertension. It wasn't for anything else. So it was originally anybody could take that drug. And then your right-sided inferior MI. Now the way you recognize a right-sided inferior has leads 2, 3, and AVF are elevated. That patient also typically is bradycardic and hypotensive. They will also have JVD associated with it. They will not be bradycardic and hypotensive initially because I still have blood flow. Eventually, I will not have blood flow left in the heart because I can't get blood back into the heart. That's where my blockage is. So that is the patient I'm not giving nitro to. Okay, but I got 90 minutes to get her to the cath lab. Okay, so that's it about STEM. Now let's go back to my happy family. We're going to talk about blocks. All right, so we know we got a bad kid, and that child left a strain on my relationship with my husband, period. I'm sorry, I hate to say it. I love my children, but he did leave a strain. So it left a strain on my relationship. So now that I have a strain on my relationship with my husband, I'm going to go into a block. Okay, so the first degree heart block is the separation. You got kids, you can't just get a divorce. You got to separate for at least a year. So first degree heart block is your separation between your husband and wife. Your P to R intervals wide at a rate of greater than 0.20 on your EKG rhythm boxes. Okay, so greater than 0.20 on your EKG strips on your P to R interval is first degree heart block. That's it. First degree heart block. That's what you're looking at. Okay, it's consistent. It's consistently wide, and if you look at it, it looks like a sinus rhythm. It's just your P to R intervals too wide. That's it. So that's a first degree block. First degree block is symptomatic. I'm atropinating them. I'm going to monitor them. I'll probably put them on a little monitor, but I'll pay attention to what's going on with them. This is typically one that we kind of just monitor. Okay. Now, what happens if my separation I can't reconcile with my husband? Marriage counseling didn't work. I'm going to get a divorce. Okay. I don't want nothing to do with him anymore. I'm done with him. He's got to go. So that's going to be where I get a divorce. Okay. So the second degree blocks is a divorce. Okay. You have 2 ex-husbands. So second degree block means an ex-husband. What I mean by an ex-husband means a dropped QRS complex. So if I am missing a QRS complex, I know second degree block. Period. It's got to be second degree block because I dropped the QRS complex. I need to know, is it Christy's first ex-husband, Mr. Winkybach, or is it Christy's second ex-husband, Mr. Movitz? And Mr. Winkybach, I married him very young out of high school, and as we got older, we grew apart. So if you remember from school, further drop, that is a Winkybach, right? Further drop, that is a Winkybach. So second degree type 1, your P to R interval is going to slowly elongate and grow apart. So that would be second degree type 1. Dropped QRS complex means divorce. So that means second degree. Now my P to QRS interval that I do have on the beta I've got tells me type 1 or type 2. It tells me which husband it is. Winkybach is the one that I grow apart from. Young and dumb 1, Winkybach. My P to QRS interval, if you look at it, are slowly growing apart and getting further before I got divorced. Okay, so I grew apart from him. Now, my second ex-husband, Mr. Movitz, I was more mature with him. I got married older, and I could stay friends with him. You know, he's a nice guy. I just can't stay married. So with that one, still getting a divorce, there's my missing QRS, but my P to R remains constant, never changes. I'm just going to stay friends with him. That one's the one I found out I was better off staying friends and shouldn't have married him to begin with. Okay, so we're now best friends, we just not married. So drop QRS means second degree. P to R interval tells you 1 or 2. Okay. Now, with that being said, what happens after 2 failed marriages? I'm done. Okay, Christy is not going to be in any more relationships. I'm over it. That will be a third degree or a complete heart block. Third degree heart block is the party and P wave. That's the one that I'm just going to do whatever I want to, when I want to, live my best life, however I want to. And all the QRSs are still there because let's be real, guys, they ain't going nowhere. But I can do my own thing. Okay, I'm going to be happy and live my best life. So the P waves party and do their own thing, and they're completely independent, but the QRSs are at a regular rate. That's a third degree heart block. This guy is the most dangerous one because nobody's talking to each other, so the QRSs don't really know when they're supposed to be firing because the P wave ain't telling them. So this one requires internal pacemaking, and blocks and pacing is really the only piece that can actually do anything for this guy. Okay. Second degree type 2 is the other one that is the other most dangerous block that requires internal pacing. Okay. Now, if I was going to pace this specific patient, what I would do is I would place my pads on my victim, just like I would if I was going to defibrillate, right? Fasten your seatbelt, so I'm placing my manual defibrillator pads on. I'm going to switch my machine to pace, which on here will be this button down here. I'll set my heart rate. I'm going to set this one up to 80 just so you can see it a little better. And I want to get capture on every pacemaker spike. So what you're seeing here is pacemaker spikes. These are spikes. This is capture. Okay, I want to get a beat on every spike. So all I have to do is adjust my milliamps on my machine in very tiny increments until I get a heartbeat on every spike. And there we go. So this rhythm is now at 80 and paced. So where my patient was in a third degree heart block, now we are at a paced rhythm of 80 at 15 milliamps. So this patient's paced. And then they need to go probably to an OR to get a pacemaker put in. Let's see.